Hello everyone and welcome back to Clinical Cousins YouTube channel, where today we're going to go over the electrical anatomy of the heart. Now, the heart is stimulated electrically, which results in a mechanical event. Remember that electrical always precedes or comes before mechanical events, meaning that the heart will become electrically stimulated before we actually get a physical contractions. But first, we must know about some basic facts. The tip or apex of the heart points downwards and leftwards. So if you are looking at someone head on, like during a AP x-ray, their right ventricle will be the first thing that sticks out to you the most. There are some important facts that we must keep in mind that will be very helpful to you later on. First, we have the right coronary artery. The right coronary artery runs between the right atria and the right ventricle, while the left coronary artery runs between the left atria and supplies the left ventricle. Remember that if the left anterior descending becomes blocked and results in an MI, it is called a widowmaker and is very deadly. The right atrium and right ventricle work to pump deoxygenated blood through the pulmonary capillaries in our lungs and back into the left atrium. The left atria and left ventricle work together to pump oxygenated blood through the vessels supplying the heart and the rest of the body and back to the right atrium eventually. Now that we are familiar with the mechanical, let's take a look at some of the electrical components of the heart. The electrical system is made up of specialized cells, meaning that they are special or different from the other heart muscle that causes contraction. Now, we must know that these cells either generate electrical pulses or they will transmit them. Cells that generate electrical activity by themselves or spontaneously are called pacemaker cells because they make the electrical pace or rate of the heart. The most important rule for pacemakers is that the fastest pacemaker controls the heart rate. The SA node is the fastest pacemaker, so it usually controls the heart rate. The following rates in beats per minute are very, very helpful and will make you an EKG master eventually. We must know the SA node has a rate of 60 to 100, the AV node has a rate of 40 to 60, and if there is a ventricular pacemaker, it is usually 20 to 40. So, if the SA node pacemaker is not firing for some reason, the AV node will pick up the slack and we will see a heart rate of around 40 to 60. Now, the series of electrical events that occur in the heart are captured and recorded on the EKG or ECG or electrocardiogram. These specialized electrical cells stimulate the heart muscle to contract. These electrical cells are like light switches. When they fire an impulse or are switched on, it tells the surrounding heart muscle to contract. Now, the heart has a certain electrical highway that it uses to transmit its impulses. The series goes SA node, internodal pathways, AV node, bundle of His, right and left bundle branches, and the little green marks that you see is the Purkinje system. First, the SA node is a bundle of pacemaker cells that sits on the posterior or back wall of the right atrium. The SA node receives its blood supply by the right coronary artery. Remember, the SA node is in the right atrium and it receives its blood from the right coronary artery. It's so simple. Next, we have the internodal pathways. Think, inter means between, and nodal means nodes. These internodal pathways are the connections between the SA and AV nodes. There are three internodal pathways: the anterior, the middle, and the posterior. These are all in the right atrium, and we must know that the anterior is on the leftmost side, the middle is in the middle, and the posterior is the rightmost and backmost pathway. Also, less importantly, there's a pathway called the Bachmann bundle, which runs right in between the right and left atria in its septum. The AV node is located on the right atrial wall next to the septal leaflet of the tricuspid valve. Its job is to slow the impulses from the SA node to allow the atria to finish filling the ventricle. Now, we should know that the AV node is always supplied by the right coronary artery. This is important because if your patient has a blockage of the right coronary artery, it will kill the AV nodal cells and the AV node will have dysfunction. Next, we have the bundle of His here in orange. It connects the AV node to the right and left bundle branches. It is the only connection pathway between the atria and the ventricles. The bundle of His breaks into the left bundle branch and the right bundle branch. The right bundle branch goes on to innervate the right interventricular septum and the right ventricle, while the left bundle branch has two main diversions. The left bundle branch breaks off into two fascicle nerves: the left anterior superior fascicle and the left posterior fascicle. The left anterior superior fascicle innervates or activates the anterior and superior left ventricle, meaning it activates the top and the front left ventricle. The left posterior fascicle innervates the inferior and posterior left ventricle, meaning that the left posterior fascicle activates the bottom and the back of the left ventricle. Lastly, the Purkinje system branches off of the right bundle branch and the left bundle branch and its fascicles to reach deep into the ventricles to activate the heart muscle. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.